There are some viruses you hear about every day. They dominate the news, they become part of daily conversation. And then there are others you almost never hear about, not because they aren't dangerous, but because they are rare, quiet, and often misunderstood. The virus we're talking about today is one of those. It's called Nipah. You won't see its name scrolling across headlines every morning. You won't hear friends casually mentioning it over coffee. But when this virus appears, it can be devastating. Medical studies from outbreaks in South and Southeast Asia show that between 40 and 75% of people who become infected do not survive. That's not a statistic meant to scare you. It's meant to remind us how seriously nature must be respected. What makes Nipah especially concerning is not just its severity, but its silence. Early on, it doesn't announce itself dramatically. It can begin like a simple flu, a fever, a headache, a sense that something just feels off. And by the time it's recognized, the virus may already be affecting the brain. Right now, there is no specific treatment, no widely available vaccine. Doctors can support the body, but they cannot yet stop the virus directly. And that brings us to the most important message of this video. This is not about fear, it's not about panic, and it's certainly not about sensational headlines. This is about understanding, because when we understand how a virus spreads, how it affects the body, and how simple daily choices can reduce risk, we replace fear with awareness. And awareness is one of the most powerful forms of protection we have. So today, let's take a calm, clear look at the Nipah virus, what it is, how it spreads, and most importantly, how ordinary people can protect themselves and their families. Not through anxiety, but through knowledge. Part 1, how the Nipah virus spreads. One of the hardest things about understanding a virus like Nipah is that it doesn't spread in loud, obvious ways. It doesn't come from crowded airplanes. It doesn't require packed stadiums or busy city streets. Most outbreaks have started quietly, in rural areas, small communities, in moments that felt completely ordinary. The natural home of the Nipah virus is the fruit bat, sometimes called the flying fox. These bats don't look threatening. They don't hunt people. They simply feed, mostly on fruit. But as they eat, they leave behind tiny traces of saliva or urine on fruit, on tree sap, or on containers collecting fresh juice. In several well-documented outbreaks, particularly in Bangladesh, people became infected after drinking fresh date palm sap, a traditional natural drink collected overnight and believed to be wholesome and healthy. The science later showed something important. Bats had visited those collection sites at night, leaving behind viral particles invisible to the eye. Nothing smelled wrong, nothing tasted strange, and yet the virus entered the human body. In other cases, the virus moved from bats to pigs and then from pigs to the people who cared for them. Farmers, handlers, people doing honest, everyday work. This tells us something crucial. Nipah is not a virus of recklessness. It's a virus of unawareness. What makes it more concerning is that once Nipah reaches a person, it can sometimes spread from human to human, through close contact, through respiratory droplets, through caring for a loved one without protective measures. Studies published by the World Health Organization and the CDC show that household caregivers and healthcare workers have been among those most at risk during outbreaks, not because they were careless, but because compassion often comes before caution. And here's the quiet truth many people don't realize. The virus does not need large exposure. It does not need dramatic contact. A small moment, an unwashed piece of fruit, a shared drink, close caregiving during illness can be enough. This is why understanding how Nipah spreads matters more than memorizing medical terms. Because prevention doesn't come from fear. It comes from recognizing the invisible connections between nature, daily habits, and our health. And in the next part, we'll talk about what happens after the virus enters the body, why the early symptoms are so easy to miss, and why listening closely to subtle signals becomes especially important as we get older. Part 2. The early symptoms. Why Nipah often looks harmless. At first, one of the most unsettling things about the Nipah virus is not how aggressive it can become later, but how ordinary it feels at the beginning. In the early days after exposure, there is often no dramatic warning, no sharp pain, no unmistakable sign that something serious is unfolding. Instead, the body whispers, a mild fever that feels like a seasonal bug, a dull headache that comes and goes, a heaviness in the muscles, that familiar sense of fatigue that makes you think, I just need a little more rest. According to clinical observations from the World Health Organization, these early symptoms typically appear within 3 to 14 days after exposure. And here's the problem. For many adults, especially those over 50, these sensations feel familiar. We've all had days when our energy dips, days when sleep wasn't quite enough, days when the body feels slower, heavier, less responsive. So the symptoms are explained away. It's probably just a flu. Maybe I didn't sleep well. It'll pass in a day or two. And often there's no reason to think otherwise. In its early stage, Nipah behaves like a virus that doesn't want attention. It doesn't announce itself loudly, it blends in. But beneath that calm surface, something important may already be happening. Medical research shows that while the immune system is responding, the virus can begin moving beyond the bloodstream, traveling toward the central nervous system. And the brain, as we know, is not forgiving when inflamed. This is why early Nipah infection is so dangerous. Not because the symptoms are severe, but because they are deceptively mild. By the time someone realizes this doesn't feel like a normal illness, the virus may already be crossing into a much more serious phase. And for older adults, this window matters even more. As we age, the immune response can be slower to signal danger. Fever may not spike as high, pain may not be as sharp. The body adapts, sometimes too quietly. This isn't weakness, it's physiology. Studies from the NIH remind us that aging immune systems often respond differently, not louder, but subtler, which means awareness becomes our greatest ally. In the next part, we'll talk about what happens when Nipah moves beyond this quiet phase, when the brain becomes involved, and why doctors take sudden confusion, drowsiness, or personality changes so seriously. Because with Nipah, the difference between early recognition and delayed response can change everything. Part 3. When Nipah reaches the brain. The signs that demand immediate attention. There is a moment with illnesses like Nipah when the conversation changes, not because panic suddenly makes sense, but because attention becomes essential. When the Nipah virus moves beyond the bloodstream and reaches the brain, doctors call this encephalitis, inflammation of the brain tissue. And the brain, as you know, is not a place where inflammation can be ignored. At this stage, the body often stops whispering and begins to speak more clearly. A person may become unusually drowsy, not just tired, but difficult to wake, as if the mind is slowly pulling inward. Confusion can appear. Simple conversations become harder to follow. Words come out tangled. Thoughts feel disorganized. Family members may notice something before the person does. A change in personality, slower responses, or a familiar face that suddenly seems distant. This is not forgetfulness. This is not normal aging. Clinical reports from the World Health Organization show that neurological symptoms can progress rapidly, sometimes within 24 to 48 hours. Seizures may occur, muscle control may weaken, balance can disappear without warning, and in some cases, consciousness fades altogether. This progression can feel frightening to witness, but it's important to understand what's happening, not imagine the worst. The virus triggers an immune response inside the brain. That response, meant to protect, creates swelling. And swelling in the brain quickly disrupts vital functions: breathing, blood pressure, awareness itself. This is why immediate medical care matters so deeply. Hospitals cannot yet cure Nipah, but they can support the brain and body through oxygen, careful monitoring, and intensive care. And timing matters. Data from multiple outbreaks show that patients who receive supportive care early have a better chance of survival and a lower risk of long-term neurological damage. For older adults especially, this stage is not something to wait out. If someone has had a recent unexplained fever, followed by sudden confusion or unusual sleepiness, trouble speaking, seizure activity, that combination deserves urgent medical attention, regardless of how mild the illness seemed at first. This isn't about fear, it's about respect for how quickly the brain can be affected. In the next part, we'll talk about the most empowering piece of this entire conversation: how everyday choices, awareness, and simple precautions dramatically reduce risk. Because even with a virus as serious as Nipah, knowledge remains one of the strongest forms of protection we have. Part 4, Practical Prevention, simple habits that quietly protect you and your family. After hearing about a virus like Nipah, it's natural to ask a simple question: what can I actually do? And the answer is more reassuring than you might expect. Because protection from Nipah doesn't come from complicated medical steps. It comes from small, thoughtful habits, the kind most of us already practice, just with a little more intention. One of the most important lessons science has taught us is that Nipah spreads not through chaos, but through everyday moments. Food, drink, close care. That means prevention begins there. Researchers studying outbreaks noticed a clear pattern. In many cases, people became ill after consuming fresh fruit or natural juices that had not been properly cleaned or heated. Fruit bats are active at night. They feed quietly, and what they leave behind cannot be seen. This is why washing fruit thoroughly and peeling it when possible matters more than tradition or convenience. It's not about fear of nature. It's about understanding how closely we share space with it. The same applies to fresh juices or tree sap. In regions where Nipah has appeared, heating or boiling these drinks dramatically reduced infection rates. Heat, quite simply, neutralizes the virus. Another layer of protection comes from something deeply human and how we care for one another. Several studies published through the WHO showed that family members and caregivers were often infected not because they ignored hygiene, but because love naturally pulls us close. Masks, hand washing, avoiding shared utensils during illness. These are not cold or distant acts. They are expressions of care, especially when someone has fever, cough, or confusion. For older adults, these habits matter even more. As immune responses change with age, reducing exposure becomes a powerful form of self-respect. And finally, there is awareness, not anxiety, not constant vigilance, just awareness. If someone develops a fever after contact with sick animals, after travel to affected regions, or after close contact with a seriously ill person, mentioning that history to a healthcare provider can change outcomes. Doctors don't need panic, they need information. And when information arrives early, support arrives sooner. Prevention, in the end, is not about controlling every risk. It's about stacking small, sensible choices in your favor. And when we do that, quietly, consistently, we protect not only ourselves, but the people we love most. In the final part, we'll bring everything together, not with alarm, but with clarity and calm, and talk about what it truly means to live well-informed in a world where rare viruses exist. As we come to the end of this conversation, I want to leave you with a simple thought. The Nipah virus is rare. Most people will never encounter it, but understanding it reminds us of something deeper, that health isn't just about reacting to emergencies. It's about paying attention to the quiet details of everyday life. We talked about how Nipah begins far from headlines, how it spreads through ordinary moments, why its early symptoms are easy to overlook, and how simple, thoughtful habits can quietly reduce risk. There was no single dramatic warning sign, no sudden line between safe and unsafe. Just small signals, small choices, small moments where awareness makes a difference. And that's especially true as we grow older. With age comes experience. And experience teaches us that panic rarely helps, but understanding almost always does. Being informed doesn't mean living in fear. It means living with a little more clarity, a little more intention, and a little more respect for how our bodies work. If this video helped you understand something new, or gave you words you could share with a loved one, that's exactly why it was made. Consider sharing it with someone you care about, not to worry them, but to inform them. And if you value calm, thoughtful conversations about health, aging, and living well in a changing world, you're welcome to subscribe and join us here. We don't chase fear. We don't rush headlines. We focus on understanding, because understanding is one of the most powerful forms of protection we have. Thank you for spending this time with me.